Hello everyone, welcome back to this channel. Today we are going to look at something new, and that is we want to look at introduction to pharmacy practice. What is pharmacy practice? So this channel is Grapharm Academy. In case it is your first time to tune in, we are Grapharm Academy. We deal with a number of course units, a number of lectures that take you through your training. And most of the course units may be pharmacy related. However, there are some course units that are shared between pharmacy professionals and other professionals in the health department. And it may also cut across. There are those that the procurement people, though it doesn't go deep into procurement, but may also be part of it. All right. So I want to introduce what pharmacy practice is and what it is. It is one of the course units that pharmacy students have to undergo or learn, and it deals with a number of things that relate to the practice of pharmacy. And we have already a lecture where we described what pharmacy is or defined what pharmacy is. So let us look right in and see our outline of today. We are going to define what pharmacy practice is, what's the history of pharmacy practice, what are the areas of pharmacy practice, and then what is the scope of pharmacy practice, and what is the role of a pharmacy professional in healthcare. So by the end of this lecture, I expect students should have the knowledge about the history and evolution of pharmacy practice, and then appreciate pharmacy practice and its relevance. Okay. So pharmacy, the word of pharmacy derived from Old French word faminis or famis, a substance as a food or in the form of medicine with a laxative effect. So pharmanis was derived from medieval Latin pharmacia, from Greek pharmakia, a medicine, yeah, and that Greek word. Pharmakia, a medicine. So pharmakia was derived from pharmakon, meaning drug, poison, or spell. The science and technique of preparing and dispensing drugs is a pharmacy, and then a health profession that links health science with chemical science is the field of pharmacy. It also aims to ensure that to ensure safe and effective use of drugs, and the discipline of pharmacy embraces the knowledge on emphasis or synthesis, chemistry, and preparation of drugs. So in case you're a new pharmacy student, you are required to have or to be good in chemistry, because you may encounter some course units that you're going to interact directly with chemistry. Not only chemistry, you also need to have the biology for your biomedicals or for your core course units like anatomy, physiology, first aid, nursing, something like that. So you find that pharmacy is basically a science and a technique of preparing and dispensing medications or drugs. So a pharmacy personnel can as well manufacture medications, or they are trained to be in position to carry out quality control tests, and in the manufacturing industry to do clinical trials. And someone can specialize in maybe clinical trial, and maybe when they're mastering in the profession, they can specify on that. So you find that pharmacy is a beautiful course, and is a noble course whereby you have to appreciate science or health science and chemical science. You ideally know what is like what components or active component is in each medication, and that information is only known by a pharmacist, a pharmacy personnel, a pharmacy technician, or a pharmacy assistant. You find that uh, maybe other professionals are trained to administer the medication. Some are trained to prescribe the medication, but they may not be knowing the active pharmaceutical ingredient in it, the interactions that the medication may bring. So you find that a pharmacy personnel is trained to embrace the knowledge of health science and the chemical science. So what's the history of pharmacy? So evolution of pharmacy profession was divided into 5 historical periods. We have the ancient era, the epimeric era, industrial era, patient care era, and then biotechnology and genetic engineering era. So let's look at the ancient era. We see that before the 16,400 AD, use of leaves, mud, and cold water to stop bleeding and heal wounds. Like they would use leaves, and these leaves are from specific plants. And you find that when they use the leaves, mud, and cold water, they would stop bleeding. Like maybe apply like a tourniquet. You get it, eh? Because when you look at your first aid, you apply that tourniquet so that you arrest the bleeding, or you like a tourniquet can have that maybe you have your cotton wool, you have gauze, and then you compress on the bleeding part. Okay, so these people in the ancient era would just literally use leaves, mud, and cold water or cool water to stop the bleeding, and this would heal wounds. And of course these medicinal leaves documented experiences of healing onto the clay tablets, which provided the earliest known written records. So most of our ancient people did not recommend most of these things, or they did not document them down. So you find that we may not have full information of which leaves were used, which roots were used, which stems were used, something like that. So we see that in Babylonia, the earliest record of the practice of pharmacy by the priest, pharmacists, and physicians was kept. This is where the science of drugs, organized pharmacy, and medicine had its beginning. So you can look at when the profession started. However, when it was starting, you find that they would have not classified it or separated it as pharmacy. It was a combined setting where it is the person as well can treat, administer the medication, and then the person would be in position to identify which leaves, which roots, which stems, which flowers manage a specific condition. And this would happen by trial and error in a way that they try these leaves, and then if they work for that, they always make sure they refer to those leaves when that same condition maybe appears to the patient. So in the Pimeric era, we see that we have the 16,000 and 1940, where the pharmacopoeia became a regular tool for pharmacists. You find that this is when the pharmacopoeia was documented. So a pharmacopoeia is like a reference material for a pharmacy personnel who is going to manufacture medications. So a pharmacopoeia gives direction or a regulatory tool that gives you on the active component of a drug, what quantity of that medication you need, what are the excipients that you need, and what's the procedure of incorporating these specific compounds. That is a pharmacopoeia, and these pharmacopoeias have been written by a number of states. We have the British pharmacopoeia, a European pharmacopoeia, there is Tanzanian pharmacopoeia, and then Indian pharmacopoeia and other pharmacopoeias that I may have not mentioned here. So Benjamin Franklin started the first hospital in 1751. It had a pharmacy, and the first hospital pharmacist was Jonathan Roberts. Okay, so in 1821, the Philadelphia College of Pharmacy was founded. A major contribution of a pharmacist to science was in the area of chemistry. However, in the industrial era, we see that in 1940 to 1970, the development of manufacturing pharmacy began. Rapid mass production of medicine followed. See that standardization, biologically prepared products, complex chemical synthesis, and increased use of parenteral medications were all parts of this period. What about in the patient care era? We see that in the patient care era in 1970, we see that at the beginning of this era concentrated on research to develop new medicines, and research on medications was done. New drugs were developed and had a lot of adverse drug reactions. So drug review and monitoring resulted. Pharmacists began to take a more hand in a role in dispensing medications and patient education. What about in the future of the pharma? What's the future of pharmacy practice? So pharmacy practice is looking at going deep into research in areas of biotechnology and gene therapy is being conducted. Medications are being produced through recombination DNA technologies, and then we also see that new therapies for cancer, anemia, and hepatitis are also being introduced. So, what are the areas of pharmacy practice or scope of pharmacy practice? So, we see that pharmacy practice may deal in for community pharmacy. You may be in research and development. It can also be exhibited in hospital pharmacy, in public health, also has to be there. In industrial pharmacy, where it majorly deals with manufacturing, and then regulatory and ethical roles, and then we have academics, and we have pharmacovigilance, training other healthcare workers. So in training of other healthcare workers is where we see the continuous professional developments. So here you may have the COPDs, continuous professional development, that is CPDs. Yeah, you may have your CPDs in your facilities where uh, pharmacy personnel may talk to a number of health workers about drug interaction, about adverse drug monitoring, about identification of adverse drug reactions, because this is the information they can share with others. In pharmacovigilance, we are going to have a lecture on pharmacovigilance where it looks at how do we monitor, how do we identify adverse drug reactions? What are the red flags for adverse drug reactions? And after we have identified, how do we report them to maybe where do we report it? Okay, so that is pharmacovigilance. In academia, we see that pharmacy practice involved in academics, whereby those who are studying the profession, they are taken through pharmacy practice as a course unit, and they are exposed to areas that they need to know when they get to the field. How should they do it? How should it be done? What is required of them? What do they need to be equipped with to deliver the right service? In regulatory and ethical roles, you find that when different regulatory bodies have been sitting and maybe ethical roles have been documented, there is need to put the knowledge of pharmacy practice at the back of the mind, so that these ethical roles that are documented is not going to affect the role of a pharmacist, pharmacy professional, or pharmacy dispenser, or I can say technician, and pharmacy assistant. Industrial pharmacy, where we look at manufacture. We looked at clinical pharmacy. We have election in clinical pharmacy is also part of the areas, by the way. I just forgot to put it down. So clinical pharmacy, we already have a lecture on what clinical pharmacy is, what it does. So I request you to check it in this specific channel and go through it and be well equipped with it. In public health, we all know the role of a public health officer or officials. They are looking at prevention of outbreaks of diseases. So you find that a pharmacy professional comes in to educate patients or to educate the community on the preventive measures, on health education talks, and also can give a health education talk on rational medication use, self-medication, what are the effects of self-medication, should a patient not get involved in self-medication, and what are the consequences they may cause when they self-medicate. Hospital pharmacy, research and development. So those are the ones. So what's the role of a pharmacy professional in healthcare? We see that there is need for a pharmacy professional to be in position to process a prescription. Processing a prescription is verifying legalities in a prescription. You need to know parts of the prescription, look at the safety and appropriateness of that prescription. Should be in position to check patients' medication records before you dispense, okay? And then ensuring accuracy in dispensing. Whenever you are dispensing your medications, make sure that the right medication is given to the right patient at the right time, in the right dose, and for the right indication that the patient has been diagnosed with. There is care of a patient or clinical pharmacy. We see that it collects and integrates information about the patient drug history, advises a patient on drug-related precautions, and then monitors and evaluates therapeutic responses. What about in monitoring of drug utilization? You find that the practice research reports or projects for the scheme to analyze prescriptions for the monitoring of adverse drug reactions. So you monitor how a patient is complying to medications, how a patient is adhering to medications, and in case of adverse drug reactions, you should be in position to report these adverse drug reactions. And if you're sure it is caused as a result of the medication, you stop the medication, like you stop the patient from taking the medication, and you try other options to manage that specific condition. Extemporaneous preparation and small-scale manufacture of medicine aims to adopt formulations to the need of individual patients. We have hospitals that participate in extemporaneous preparation and small-scale manufacture of medications, whereby specific patients are given a specific or they formulate a dosage for a specific patient based on the prescription that has been presented to them. So this extemporaneous preparation is in small scale in a way that it is unit dose based, where a patient is like manufacture or formulation is done, compounding of this medication is done in a health facility to make sure that a patient is given this specific dose that might have come in tablets, and yet a patient is unable to take tablets, maybe children, and you have to give them the syrup. So you can compound it in syrup form if you had a tablet form. Okay, so this happens in hospitals. However, manufacture of medication happens in the industry. So traditional and alternative medications, there is need to supply of traditional medicines, and hemopathic prescriptions has to be taken into place. And responding to symptoms or minor alignments, there is need for a pharmacy professional to be in position to handle symptoms of minor illness. A pharmacist may respond without supply of medication. You can as well advise a patient on what to do. There are some conditions that are management based in a way that you may not need medication to manage them. They call them non-pharmacological management. So you find that there are conditions that only non-pharmacological management can help this patient relieve the symptoms. Okay. Informing healthcare professionals and the public. There is need for a healthcare professional to be in position to inform healthcare professionals about existing and new medicines, promote rational drug use among health professionals and patients. Okay. There is also health promotion, should be in position to participate in sensitizing communities locally or nationally on health related issues such as rational drug use, alcohol abuse, tobacco use, and so many others that may be affecting that specific community. So before health education or health promotion is done in a specific locality or community, there is need to do assessment, pharmaceutical needs assessment of that specific community. After you have carried out pharmaceutical needs assessment of the community, you are able to deliver to them what they need. Because sometimes if you just go and like do your health promotion without identifying the need of the community, you'll be in position to talk the obvious things that the community does not need, okay? And you look irrelevant and you become irrelevant to that society. So there is need for to always carry out needs assessment. What does a community need? What is the community lacking? What should I talk about? What is affecting this community more? And then you should be in position to talk to that community. For example, if you're going to a primary school and then you're telling them about alcohol abuse, or maybe you find that maybe P1, primary 2, you're talking to them about alcohol abuse. These children ideally have no idea. You can talk about personal hygiene, brushing teeth. They can have an idea or grasp what you're trying to tell them. So it's good to do needs assessment before you go and do a health promotion. So what about the documentary services like providing advisory or advice and supply services to residential homes for our elderly and long-term patients? Should also be done. And then agricultural and veterinary practices, our pharmacists should supply animal medicines and medicated animal feeds. Okay. So what are some of the reference materials that we have used for giving you all this information that we have talked about? So these are some of the reference material that we have used to deliver to you whatever we have managed to provide to you today in this session. In your own free time, you can visit these different reference material and have more understanding because we got a summary of what we needed to present. So thank you so much for your time. Thank you for listening. If you came this far listening to this lecture, we want to say thank you so much. Thank you for supporting Grapham Academy. Like, share, subscribe to content in this channel to support this channel in making more videos like this. I wish you all the best. God bless you.